The idea of using senolytic drugs to combat aging and chronic disease is captivating, especially when we consider their potential to target the root cause of multiple disorders rather than just manage symptoms. But for any therapy aimed at extending health span or reversing degenerative processes, one question is especially critical. Can senolytics be used safely in the elderly, those who arguably need them the most? This isn't a hypothetical concern. Older adults often carry the highest burden of senescent cells, but they also face the greatest risks from new pharmacological interventions due to frailty, polypharmacy, organ decline, and immune dysregulation. Using potent drugs in a population that already struggles with multiple comorbidities raises serious questions about safety, side effects, and dosage strategy. As clinical trials cautiously begin testing senolytics in human populations, especially those over 65, the early data offer both optimism and caution. Let's begin with the mechanism of action because this explains much of the concern. Senolytics don't simply quiet senescent cells, they induce apoptosis, or programmed cell death. This is a powerful process. In essence, these drugs act like targeted assassins, selectively destroying cells that have stopped dividing and are causing harm through chronic inflammation, fibrosis, or tissue degradation. But even with selectivity, there is collateral risk, particularly in tissues where senescent cells may still serve protective roles, such as in wound healing or tumor suppression. One of the earliest combinations tested in humans was dasatinib and quercetin, D plus Q. Dasatinib is a tyrosine kinase inhibitor originally used in cancer treatment, while quercetin is a plant flavonoid with senolytic effects. In a 2019 pilot study at the Mayo Clinic involving patients with idiopathic pulmonary fibrosis, IPF, a serious and age-related lung disease, just 3 days of intermittent D plus Q dosing showed improved physical function, including walking distance and chair stand time, without severe adverse effects. Participants were older, average age 70. And although the study was small, it marked a critical milestone, the first demonstration that senolytics could be tolerated in a frail, elderly population with significant disease. More recent trials have expanded the scope. One study published in eBiomedicine, 2023, looked at D plus Q in older adults with early-stage Alzheimer's disease. While the sample was again small, no major safety issues were reported during short-term administration, and participants showed modest cognitive stabilization, sparking interest in further trials. Another trial investigating Fisetin, a naturally occurring senolytic found in strawberries, in elderly individuals with multiple comorbidities, such as diabetes, obesity, and cardiovascular disease, suggested that Fisetin was well tolerated, even in those on multiple medications. However, safety is not guaranteed, and certain risks must be emphasized. Dasatinib, for instance, is a powerful drug that can cause cytopenia, fluid retention, and gastrointestinal disturbances at high doses, effects that are especially concerning in frail patients. Most senolytic trials to date use intermittent dosing, with hit-and-run strategies that aim to eliminate senescent cells without continuous exposure. This helps reduce toxicity, but the long-term effects of this strategy are still unknown. Could repeated senescent cell clearance, over time, impair the body's ability to recover from stress or injury? Might it accelerate other forms of tissue wear? There are also concerns about organ-specific vulnerability. For example, if senolytics clear beneficial senescent cells in the kidney, could this precipitate or worsen renal dysfunction in older adults already at risk? Could suppression of the SASP interfere with immune surveillance of precancerous cells? These questions are not fully resolved, and it will take multi-year trials and much larger cohorts to determine whether the risks outweigh the benefits in various populations. One hopeful trend is the emergence of natural and low-toxicity senolytics, like Fisetin and ovanillin, which have shown promising results in preclinical models with minimal side effects. Fisetin, in particular, has been studied in aged mice and shown to reduce inflammation, improve cognition, and extend lifespan, all without the toxicity seen in more aggressive agents. It's now under investigation in multiple human studies, including the large-scale AFFIRM trial, which specifically targets older adults at risk for frailty and cardiovascular decline. Another angle of safety lies in the intermittent dosing model itself. Unlike daily pharmaceuticals, senolytics may only need to be administered once every few weeks or months, depending on the senescent cell turnover rate. This strategy reduces drug burden, minimizes chronic exposure, and may allow for careful monitoring between cycles. It also allows researchers to test the effects of a single treatment round, which could reveal whether short bursts of senescent cell clearance are sufficient for therapeutic benefit. In clinical settings, senolytics are also being evaluated for targeted use, rather than general rejuvenation. For instance, in osteoarthritis, localized injection of senolytics into the joint avoids systemic exposure entirely. This targeted delivery model, if expanded, may greatly reduce safety concerns while still addressing organ-specific degeneration common in aging. In summary, what does the research say so far? The early-phase clinical data suggests that senolytics can be used safely in elderly populations, at least in short-term, low-frequency regimens and with proper monitoring. Side effects appear manageable when doses are carefully calibrated and patient selection is thoughtful. The biggest safety concerns lie in long-term effects, interactions with other medications, and the possibility of disrupting beneficial functions of senescent cells. Still, for a growing number of older adults with multiple degenerative conditions and few curative options, senolytics may offer the first true disease-modifying approach, one that doesn't just mask symptoms, but removes the dysfunctional cells contributing to disease itself. With cautious optimism, rigorous trials, and improved precision in delivery and dosing, senolytic therapy could become one of the most impactful medical advances for healthy aging, particularly for those who are already old.